The information discussed by the host and guests on this talk show is meant to be informational only. Listening or calling in to ask questions for our guests does not create a patient-doctor relationship. Rely on your own doctor or healthcare provider's medical advice to treat or diagnose any conditions you may have. Nothing discussed on this talk show is meant to replace your doctor's medical advice. You should never stop your current medical treatments or delay getting medical treatment because of anything presented in this program. If you want more information about a medical condition or treatment discussed on this program, talk to your doctor.
It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Everybody, welcome to Health Check. I'm Heidi Godman. Hope you're doing well on this fabulous day. We have a very, very interesting program lined up for you today. It is Monday, and so on Mondays, we like to do our weekly brain boost, and that means later on in the program, we are going to be speaking with prominent neurologist Dean Sutherland. Dr. Dean Sutherland, great friend of mine, and he's on the show every Monday, and we talk about some really interesting things. Today, it's going to be something that may be sort of a game changer in the world of ADHD. Now, this is sort of an umbrella term for a number of different conditions that can fall under this. It's the official name is attention deficit hyperactivity disorder, ADHD. But you may just have an attention issue when it comes to focusing and things like that. You may have a hyperactivity issue, or you may have both. So we're going to be speaking about ADHD. It used to sometimes, if you just had the attention issue, sometimes just used to be called ADD. But we're going to be talking about a new study that suggests people with ADHD have differences in their brain and in the brain structure. And this is really important because a lot of folks who have kids with ADHD, the parents are accused of, well, not parenting well, or the child is accused of being lazy. This happened in our own family. We have two kids in our family, my nephew and my son, Chris. And these kids have ADHD, two very different cases of it. My nephew has a different kind than my son. But if they weren't working with teachers or people who really were familiar with their conditions, sometimes there was a real tendency for people to just say, well, it's this, or blame this or that. Not everybody understands a lot about ADHD, and some people just are likely to chalk it up to something else. And as health reporters, my husband and I have been fighting this fight for a long time. But now there is a new study that Dean's going to be talking about in our weekly Brain Boost that suggests, again, that these are brain changes, structural changes to 5 different regions of the brain. So we're going to find out about that, and we're going to find out what kind of difference that makes and what this might mean. We're also going to be talking today about some developments in the world of aesthetic dermatology and cosmetic dermatology. So we're going to be talking about lasers that can melt fat. We're going to be talking about ways to grow hair using platelet-rich plasma. You may have heard of this, PRP, and people say that it's great for all kinds of conditions. And one that we're going to talk about today is hair growth. We're also going to be talking about lip line filler. Are those something you should give a try? Is there any risk to them? What about all of these things? Do they have side effects? Is it too expensive? What does it mean? Should you do this? Is it really just a cosmetic thing, or does it go a little bit deeper? We are going to find out more about that. And joining us is my good friend, Dr. Manjula Jegasothy. She's founder of Miami Skin Institute. She's an aesthetic dermatologist trained at Harvard and Yale. And she's also an associate professor of dermatology at University of Miami School of Medicine. And she is here with us today. How are you doing, Manjula?
Thank you. I'm doing great, Heidi. Happy President's Day.
Yes, and to you too. So glad that you are here with us today. So we are talking about some very, very interesting things today. And the first one we're going to talk about, I kind of like it in the terms of a gadget, because when I was a TV reporter, I always loved going into the operating room and getting to show our viewers the latest and greatest cool thing. So anytime I hear the word laser, I think that's super cool. And then when, you put fat melting in front of the word laser, I think that's really great. But we've actually, and I think of Star Wars, but it's not like that at all. And we've actually had lasers for quite a while, right?
Yes, and this machine actually is one of the newest. It's literally only 3 or 4 months old, and it is radio frequency. So remember, we had that discussion, I think, on our last show about the difference between radio frequency machines, we call them devices, versus lasers, which are in the light spectrum. So this is actually a device, and it is kind of Star Warsy because you sit under this sort of handpiece that's a U-shaped, almost like it literally looks like a hand, and it uses the radio frequency to melt the fat, and it never touches you.
That's amazing. So how does it melt the fat? Does the fat come back? Do you feel anything? So many questions.
Sure. So it sends the radio, so since it's in a U shape, it basically sends the radio waves in a crisscross fashion and you place it about an inch away from the patient's skin. So basically what that does is that they've sort of engineered it so that then all of those crisscrosses meet at a certain place that's about 1 to 2 centimeters below the skin surface, so that you don't have any heating on the skin itself, which is where all the nerve endings are and which is where you can get burns or blisters. And it goes directly to the fat cells, which have no nerve endings, so there's no pain and there's no burning or anything like that. And it literally heats up the fat cell layer without heating up the overlying skin. It's amazingly painless, and you feel the fat heating up as time goes on. The procedure takes about 45 minutes, and you feel it heating up as time goes on, but the skin never heats up and you never get any burning.
Now, where are we talking about using this laser?
So this laser, we've talked a lot about Kybella over the last few sessions, our last few talks, and that's for sort of thinner people with the BMI, a body mass index of less than 25. This is more for, moderately to overweight people. So, and it can be used, there are different hand pieces. I have large hand pieces for the stomach and hips. I have hand pieces for the back, and then I have smaller ones for the thighs and for the arms.
Mm-hmm. Now, is this known as laser lipo? Is it getting that reputation, or is that something different?
Laser lipo is a specific, it's sort of the lay term for a specific combination of treatments with a machine called the liposonics machine. That machine uses ultrasound, but you actually are performing liposuction. So that's an actual surgery where, the surgeon makes a little hole and puts in a cannula that has this ultrasound technology, and he uses the ultrasound to break down the fat cells, and then that makes it easier for him to suction it out without, having to do a lot of vacuuming. I don't know if you've ever seen a liposuction procedure, but it's quite vigorous.
Oh, yeah. It's disturbing, I would say. Yeah.
Yeah, so the vigorous is a kind word. So anyway, the liposonics makes it so that the surgery is less vigorous, and so you have easier downtime, less bruising, etc. Like I said before, this machine is revolutionary because it's the first one that does not touch the skin at all. It does not touch the patient.
Mm-hmm. Now, I do remember reporting on something about 10 years ago, maybe called Zerona. You remember that one? And that was also didn't touch the skin. Maybe it worked in a different way.
Yes.
But so
Zerona's data isn't great, and so it's kind of fallen by the wayside compared to the newer devices. That was an interesting machine. It had kind of a twirly, you might have remembered.
I do.
A twirly headpiece that shot like a red light. That's low-level LED light, which we're using now is really as home technology. People can use it to zap their pimples at home. There are a lot of things like that because it's very low-level, but it didn't really give us much results, so it's kind of fallen out of favor with the aesthetic doctors.
Mm-hmm. But it's important to say that this uses radio frequency, which is a much different technology. And what about
much higher energy levels too?
What about are there any risks associated with it?
So they did thousands of patients in their most recent FDA studies, and the only risk is that you can occasionally, if you had a cyst under the surface of the skin or an ingrown hair or a pimple, that can form a blister. And that's the only thing that can happen, and those blisters typically resolve within a week with no pigmentation issues or anything like that. And that, unfortunately, we can't see if you have a deep ingrown hair or something, but if you have something that's superficial, then we can avoid it by adjusting the laser so it's not hitting right where that ingrown hair is.
Okay, but really cool development that, we have ways to just melt fat. How long does it
Yes.
last? Do we know how long it lasts?
So essentially, the fat cells that this machine destroys on any given treatment, that's permanent. But we don't get all of the fat cells. So if you gain weight, if you eat a lot and gain weight, the other fat cells you have will grow larger. So your overall appearance might stay the same. So, obviously in all of these things, we want this to be motivational for you to eat cleaner and to eat better and to exercise and to do all of those things so that you don't gain weight. And then, it's technically permanent.
So what would be the benefit of having this done? Even if you're cheating and you could still look the same, what's the benefit of getting rid of some of the fat cells? I can think of a few benefits right off the bat when it comes to estrogen and different things that fat cells secrete.
And insulin levels, too. So, destroying, let's say in 4 treatments, we destroy a quarter of your fat cells in a given area. Studies show that then your insulin levels will be that much lower, and so you're that much less hungry, and so you're that much more likely to eat less on a given day, and then hopefully that will become your new habit. And so it changes your whole spiral of the way that your metabolism works and that you eat and you're dieting, and it should even continue to, the results should self-perpetuate.
Mm-hmm. All right, so that could be a good start of something new for someone who's just trying to control weight and maybe is worried about other chronic conditions that could develop. But what about for people who just are in this purely for the cosmetic reasons? They've got to go into it, it sounds like, no matter what the reason, thinking that you're committing to a lifestyle change.
Yeah, I'm hoping that everybody is, and I'm hoping that even if you're not committing to a lifestyle change, this will motivate you to consider a lifestyle change. Of course, I think as a nation, we're trying to become healthier, and so I don't think that people who aren't trying to eat right and to exercise, they're not coming to my office anyway for this treatment. These are people who are trying in some way. It might not be as successful as they'd like it to be, but hopefully this will give it a kickstart. And then also, there are lots of people who are doing the best they can and still have stubborn areas. We know as we get older, especially as we're menopausal, we sort of deposit fat in our stomach area due to increased cortisol levels, and those fat cells are very stubborn and very resistant to diet and exercise. What we used to be able to accomplish in our 20s, we can no longer accomplish in our 50s. And so the lasers are great for things like that, stubborn areas. Okay.
But then let's say that you go through a few treatments and you've gotten rid of some fat cells and you're dieting and not dieting. We don't use diet, but you've changed your diet to a healthy.
You're eating clean.
You've changed to a healthy diet, and you're getting the right amount of exercise and strength training and things like that. Are you left though with some saggy skin where the fat used to be?
No, and that's why I love radio frequency as a technology in general, and I prefer it to ultrasound for that reason. Is I think that radio frequency has been shown in thousands of studies using, multiple lasers of different brands, that it tightens the skin as well. Even though this is a contactless laser, it basically tightens the skin from the underneath because it's really hitting at the level right below the dermis. And so I've not had any patients with loose skin, and neither have the studies.
Okay. All right, and for people just tuning in, tell us again how long this fat burning may last.
So it's permanent unless you gain weight, and I'm talking significant weight, more than 10 pounds.
Okay, so that's very encouraging. Now, what about cost? If someone is seeking out a physician to do this, how much would you expect? And also, how do you find a physician to do this?
Absolutely. Well, the easiest way to find a physician is to go onto the website. The laser is called the VanquishME. There was an older version of the laser. This ME version just came out in October of last year. So just Google VanquishME, and then it has right there, find a doctor, and you can find one. You can put your zip code in and find a doctor. The FDA studies for this machine recommended 4 treatments spaced about 2 to 4 weeks apart, and then patients lost an average of 3 inches circumference in any treated area. Some patients lost as much as 5 and 6 inches, which is, why I bought this laser, because I think that's significantly more than other lasers we've seen in the past. And they recommend charging around $3,000 to $3,500 for the package of 4, which works out to around $800 a treatment. It all depends on where you are. So it's anywhere from, I'd say, $500 to $1,000 a treatment, depending on what part of the country you are.
Okay. All right. So for people who are thinking about any kind of a procedure to remove fat, that should definitely be one that they put on their list to investigate and see if it's right for them. Okay, very, very interesting development. But we have so much more to talk about. Going to take a quick break. Everybody stick around. When we come back, more with Dr. Manjula Jegasothy, a Harvard and Yale trained aesthetic dermatologist who's the founder of the Miami Skin Institute and associate professor of dermatology at University of Miami. Just so much to talk about. This is Health Check with Heidi Godman on WSRQ. We'll be right back. Welcome back to Health Check. I'm Heidi Godman. So glad you are with us today. My guest is Dr. Manjula Jegasothy. She is a Harvard and Yale trained aesthetic dermatologist, founder of Miami Skin Institute, which you can check out by going to MiamiSkinInstitute.com. She's always on the cutting edge of the coolest treatments and gadgets, and I love having her on because she gives us all different views of a particular situation. And we've been talking in our last segment about fat melting lasers and the pros and cons. Now we're going to talk about lip fillers. So there are a number of different lip fillers, but why would you want to get any fillers? Manjula, what is the most common cause of a need for lip fillers? I mean, does everyone get those lines around the lips?
Yes, so 2 things. We used to call them smoker's lines, but, there's lots of people who get them just because of the way they enunciate or they use the way they move their mouth to chew or eat or speak. That gives you those vertical lines. And, even if you're not that cosmetically inclined, it's terrible when your lipstick feathers or bleeds into those lines. That's just, that's something people who don't want anything done, they can't go out in it because by the end of the night, their lip is into the whole area around the house.
Sure. And I can think of, using a straw might give you those lines, or whistling.
Absolutely.
I remember my mom would say, "Don't whistle, don't whistle. You'll regret it."
All those things your mom and grandmother told you had a real basis. It's funny. The more we learn about cosmetic issues, like the ladies who used to use the theatrical tape to tape up their necks or their, all that stuff really it works.
Right. Well, tell us a little bit about treating lip lines, because to me it seems like it would be very painful. But how do you do it, and what has the evolution of these treatments been?
Sure. I think what, I want us to take it from this, and using fillers that are getting more and more of them approved at an increasing rate because we're starting to see that different viscosities or thicknesses of the fillers has a very big impact on how successful you will be able to treat a certain area. So Volbella is like Restylane Silk or Bellotero in the sense that it's a very thin viscosity filler. And so it's wonderful for treating very superficial lines, such as lip lines or the most superficial laugh lines. And it's also great for the body of the lip because even though it's thin, it gives you a nice sort of soft, very natural look.
Okay, so how does it work when you get a filler in your lip line, and how do you know if you're a candidate?
So if you have any smoker's lines at all, you're already a candidate. If you feel like the other thing is, especially in Florida, years of sun, even if you're careful about it, etc., in certain skin types, particularly fairer skin, causes the lips to cave inward. So a lot of people simply don't have the lip shape, the mouth shape that they had 20 years ago. And so if that's the case for you also, then you're a candidate for lip fillers. And the way it works is pretty simple. We put numbing cream on the patient, on the area that we're going to inject, whether it's the lines or the body itself, and then we give them ice for about 5 minutes before the procedure, numbing cream for 15 minutes, ice for 5 minutes, and then we inject, and most people with the ice find it quite manageable.
All right. So how many injections does it take? I mean, are you just going to each individual line? And what is that like? Does it take several different treatments or is it just one time?
No, it only takes one treatment. And it used to be that lip fillers only lasted about 6 months. But with this new generation of lip fillers, including Volbella, you can get up to a 10 to 12-month longevity, which is significantly better than in the past. The procedure, the actual body of the lip, I usually accomplish in 4 to 6 injections. The lines, yes, unfortunately, we do have to inject into each line to get it precisely placed. So it depends on how many lines you have.
What's an average amount, do you think, for an older woman?
About maybe 5 or 6 on the upper lip and maybe 2 or 3 on the lower lip.
Okay, that's not too bad. But it still sounds painful to me. I don't know. I'm starting to get those lines, but I don't think I think I'd be too chicken to get it. And so you get this, and it might last for a long time, up to a year. But what about, is there a more permanent way to get rid of these things? What do you think about the future of lasers when it comes to treating those lines?
Absolutely. I think, plastic surgeons love to do resurfacing lasers, those really strong carbon dioxide lasers that we used to do in the old days where patients would look like, they were red and almost like a burn patient covered up in bandages for a week to 2 weeks. That was considered the most popular way to get rid of these lines, but the results aren't very natural. Now with Fraxel improving more and more, each generation of Fraxel is better and better. I think that that's the future of these lines, is that we would do Fraxel and inject this filler, and then you would be able to just do Fraxel treatments once a year after that and be able to maintain it line-free.
Sounds like it's getting easier to manage.
Yes, much less painful, too, like you said.
Okay, that's encouraging. All right, we are going to take a quick break. Before we go to the break, want to let everybody know that we are speaking today with Dr. Manjula Jegasothy. She is an aesthetic dermatologist, founder of Miami Skin Institute. If you want to check out what she does, go to miamiskininstitute.com. She's incredibly media savvy. She has Facebook, Twitter, Pinterest, LinkedIn. She does all of it. And very, very interesting. She has podcasts. She does all kinds of stuff. And if you are interested in finding out more, again, miamiskininstitute.com. When we come back, we're going to speak with Manjula about PRP, platelet-rich plasma, for hair growth. This is Health Check with Heidi Godman on WSRQ. We'll be right back. Welcome back to Health Check. I'm Heidi Godman. Time now to talk about something called platelet-rich plasma. Now, you may have heard about this using your own platelets from your own blood, and doctors can sort of spin them out of your blood and then use that very thick concentration of platelets to inject them into injured tendons or ligaments or muscles or joints. And the studies have kind of been mixed on whether or not it can help you reduce pain and regenerate the healing. It appears that maybe it is promising for tendon injuries and things like that, but we are still trying to find out how effective it is when it comes to healing other joints. But what about using platelet-rich plasma to regrow hair? This is a very interesting development, and I have seen and interviewed patients who've tried it, and it's worked for some people. My guest today is Dr. Manjula Jegasothy, who's she's an aesthetic dermatologist trained at Harvard and Yale. She's also an associate professor at University of Miami School of Medicine, founder of Miami Skin Institute. Such a long title, Manjula, for such a wonderful person. And thank you so much for being here with us today. So PRP for hair growth, this is something that you're doing more and more.
Yes, as you mentioned, PRP or platelet-rich plasma, I think is, the organic treatment of the future. If lasers are the electric treatment of the future, then this is the organic treatment of the future. It's a great thing because it really harnesses the patient's own blood, so there's no risk of any sort of foreign body reaction or anything. If anybody's, we've demonstrated that Botox and fillers and all lasers are very safe, but this is something that's definitely safe because it belongs to you. And essentially what we do is we take the patient's blood and we spin it in a centrifuge, which is a machine that makes it go around very rapidly, and it breaks open the platelets. The platelets have all these growth factors that are in them, but are not able to work until we actually need them, like when you get a cut. That's why when you get a cut, immediately the platelets come to the scene because they have all these growth factors in them to heal the cut. And so we're just opening up those platelets and then injecting them into various areas. For the podiatrists, they're doing it for plantar fasciitis. The orthopedists are doing it into joints after joint replacement. And then we're doing it as dermatologists into the scalp for hair growth, because anything that's a growth factor will help grow hair. So that's basically the theory behind it. I'm seeing typically that a lot of people's scalp issues or hair growth issues or hair loss issues can be related to scalp health. So at first, the big thing we're doing is we're nourishing and supporting the skin of the scalp so that it's much more healthy and much more productive and more likely to grow better quality hair. And that I find very useful in women who are experiencing hair loss after pregnancy or childbirth or after surgery or some sort of trauma like that, a motor vehicle accident, all those things that really cause metabolic disturbances. And so then the first thing that responds to that is the hair. And so I help those patients get through that sort of bump, and then, then their own mechanisms take over and they grow their normal hair again. But that first year after having a baby can be rough. And so I do it for that. For men, a lot of balding is really testosterone mediated, and so that's harder to combat with something like PRP. But if we catch a guy when it's in his very early stages of hair loss, if we do the PRP maybe once a year, it can sort of delay the onset or the rapid balding phase by 5 years or so.
Is it going to stop it?
No, I doubt it'll stop it because, as I said, that's testosterone mediated. So we would need to figure out a better way. That's how Propecia works. It's a testosterone blocker in the scalp, but we would need to find something that would do something more specifically block the testosterone receptors in the scalp for male pattern baldness for it to be really effective. I really love PRP for all these other causes of hair loss that are not hormonal, that are really related to, like I said, traumas or upheavals in the body like surgery or pregnancy or even breastfeeding, which metabolically very taxing for the woman.
Mm-hmm. And don't you have to catch it? You were saying you have to get in the early stages while the hair follicle is still there.
And while it is actually capable of producing a thick terminal hair, with men, as they start to bald progressively, the actual hair follicle changes. It becomes miniaturized. And so it is only capable of producing a miniature hair, such as on the order of like smaller than an eyelash. So you can't ever get that follicle to grow a normal hair. So that's why you need to catch them early. So
if you already have areas of baldness and it's smooth skin now and no hair there, PRP is not going to bring it back.
No, and then when you said about areas of baldness, so those patients that have alopecia areata where they have patches of balding, mm-hmm. I think that this can actually help those patients because they have a metabolic issue. It's considered autoimmune, but if we stimulate those hair follicles, we might be able to overcome the immune factors that are blocking the hair growth in those places.
And what about postmenopausal women? For some of those women, and it's hormonal related, but for some of those women, they have hair thinning.
It's also a body. It's more, for men, it's really testosterone mediated. For postmenopausal women, it's that all the other things that are going on in your body because of the hormone upheaval is causing this. So it's not directly estrogen related, so mm-hmm. it's more treatable with PRP. I'm getting very good results in postmenopausal women.
Yeah, so that's what I was going to ask. What are you seeing in your office?
So I'm seeing mostly women who've just given birth. And having that post-baby hair loss for the year. And you're not sleeping properly. All those things contribute, So I'm seeing those women. I'll do 2 or 3 treatments. They grow back their hair much more rapidly, and then their body takes over. I'm seeing people who've had surgery or some kind of, like I said, some big upheaval, like a motor vehicle accident or something like that, and they're losing hair from that. Or, some people who are just, having an incredibly stressed out time in their life. They lose hair from that. This helps that. And then I'm seeing women who are postmenopausal who are just losing hair because of all the other things that are going on at their body.
Does it ever not work?
I haven't had a patient who it hasn't worked to some degree on. People disagree on how much they want it to work in terms of, what they're willing to pay for it. The studies so far, there have been, I think, 3 or 4 large-scale studies in the dermatology literature in the last year or so, showing an average of about 30% hair growth in most patients. So that's pretty much what I'm seeing. I've had a couple of patients who've experienced as much as 40 to 50% hair growth after two sessions. I usually don't have to do more than 2 sessions on most of these patients who are having, a temporary stressor in their life. Mm-hmm. The postmenopausal crowd, I just generally do them about once a year, and, they think it's better and they're happy with it, but I haven't quantified those results.
Sure. But if you stop getting it, then it stops working, right?
That's unclear. That's what's nice about it, because it's not like Rogaine, which opens up the blood vessels and gives the hair more nutrients. That's kind of that concept, too. And so it stops working when you stop using the Rogaine. Here, I've sort of resupplemented your scalp with growth factors that have gone away for whatever reason. And it's possible that they might hang around for a really long time. We don't know that.
All right. And what about cost for something like this?
I charge $500 a treatment session for the entire scalp.
Okay. All right. I've heard of places where it's much more expensive than that. And this is happening in so many different doctors' offices. If you do specifically want to get it for hair loss or thinning hair, you should only go to a dermatologist, right?
I think a board-certified dermatologist, yes. I think that, treating the hair and diseases of the hair is really a dermatology specialty issue. So the reason you want to go to a board-certified dermatologist is because we can diagnose what is the reason for your hair loss. It may not just be hormonal. It may not just because you were pregnant. And so that's why you need to do that, because you may actually need some other kind of treatment. And that's why it's, I think, best not to go to a non-physician for this.
Sure. All right. Well, there's so much to know about it. And thank goodness that you are there to give us some insight. And we sure appreciate it. Dr. Manjula Jegasothy, thank you so much. I'll give everybody your information. So great to talk to you.
Wonderful. Thank you, Heidi.
Okay.
Have a great day.
You too. Talk to you soon. Everybody, again, that's Dr. Manjula Jegasothy. She's an aesthetic dermatologist trained at Harvard and Yale, and she's the founder of Miami Skin Institute. You want to check out more information about her, go to MiamiSkinInstitute.com or University of Miami School of Medicine, the Miller School of Medicine, where she's a clinical associate professor of dermatology. We are going to take a quick break. When we come back, we are going to talk about potentially a game changer for ADHD. This is Health Check with Heidi Godman on WSRQ. We'll be right back.
If you want me to stay, I'll be around today to be available for you to see. I'm about to